1370 WOCA.
Ocala.
It's a beautiful Monday morning in Ocala. 62 degrees. Temperatures today reaching 82. It's going to be pretty mild and just pretty. It's just going to be that way all the way through the rest of the week. And I know we need rain, but right now, no mention of rain in the forecast. And it's just a beautiful day out there. Bern Paraiso just made it a little more beautiful in here. Bern is here from Good for All Marketing. And today, Bern has brought with her a guest, Dr. P. Narayan. He's a urologist. We're going to talk about prostates. Two of us in this room have one. Two of the people in this room don't have one.
We definitely are going to be talking about prostates, Larry.
Good morning, Bern, and good morning, Doctor. Good morning, both of you.
Good morning.
How are you?
Good.
Good to see you. Do you like
see you too?
I'm right? Two of us have prostates.
That's
two of us don't.
Right.
Right.
I'm happy about that.
Just one of those things I know. There's not much I know, but I know that one.
Well, good morning to all our medical, providers in Marion County and all the neighboring counties. We are so blessed today to have a urologist.
Yes.
And like what Larry was saying, this is Dr. P. Narayan.
Yes.
And Dr. Narayan is board certified in urology, and he's bringing a lot of experiences here. Plenty, vast. What else?
Yeah.
And just for the information of our community, we have a lot of listeners that are not so familiar about urology. And what are urologists? So let's cover a little bit about urologists or specialists that they treat and diagnose urinary tract. Dr. P, can you help me a little bit about this?
So urologists are physicians who are specialists in urologic care, which includes diseases of the prostate, incontinence, sexual dysfunction, and a variety of cancers that involve the urinary tract, such as kidney, bladder, prostate, testicular cancer. There's also a number of problems that men and women face with conditions such as prostatitis in men, urinary tract infections in women, incontinence. All of these are treated by urologists. They're different from nephrologists who deal with the medical part of the kidney, which has to do with dialysis and control of hypertension and those issues. Urologists are mostly, they're 50% medical and 50% surgery. They deal with a lot of the surgical systems of the urinary tract.
Oh my gosh! So you have a very specific jurisdiction, to use a law enforcement term.
Yes, sir.
Right? You don't go upstream very much, right? You stay right down there.
Well, most of the illnesses involve the lower urinary system, but there are problems with the kidneys.
Yeah.
And a lot of that, a very common one is the kidney stones and ureter stones. So we take care of all that.
Oh my gosh!
We're sort of the plumbers of the medical system.
Yeah.
I love that.
Talking about kidney stones, that's men and women only. And also urologists, they specialize the reproductive organ in men.
Correct.
Yes, I know.
Only. That is correct.
Yes.
This is not limited to men and women, but mostly prostate cancer
Yes.
for men. Now, I had a call this morning if urologist is limited to men only. So again, just like what Dr. Narayan mentioned, that the benign prostatic hyperplasia, which is BPH, that's very common among men. And we also have, doctor, you treat infertility in
Correct.
women and
Yes.
men as well, right?
Yes. So the problems of infertility are treated by a combination of the GYN and reproductive specialists along with urology. We take care of the men's part, but more and more nowadays with all the modern technologies, it's a team effort because you have to make sure that the men's sperm is appropriate and fertile, and then the women's system is ready to receive it. So oftentimes it's a joint effort.
How do you do that? How do you make sure sperm is working?
So basically, when we look at the semen analysis, we have several criteria we look at, such as motility of the sperm, the number of sperm. Although it takes only one sperm to create a human being,
Right.
we still have to make sure that there's enough there to get to the right spot.
Wow.
So there's a lot of
You can actually see them. I mean, like when you see them in a textbook.
absolutely.
Oh
yes.
wow.
Can you tell if the sperm is a good sperm or if it has some deficiencies? Because I've heard that when a man gets in his older years, if he fathers children, the child may have a potential not to be 100% or to have some abnormalities.
That's a very rare case. Most of the time, what happens is the sperm are either normal or abnormal, and the fertilization doesn't happen. So it's very rare that, at least from a sperm physiology point of view, that you'll have an abnormal sperm that can actually fertilize. It's the ovum that can actually have some problems.
Oh.
But having said that, if the older the male, the less sperm there's going to be, and the less chances of fertility.
The one thing that we were going to focus on today, right, is the prostate, right?
It is, yes, a prostate cancer. You know, we have this, it's a very high tech. It's called an ultrasound, but it is,
Let me help her.
yes, help me a little bit with that.
Prostate cancer is the second most common cancer in men worldwide. It is also one of the most common cancers in the U.S. other than skin cancers. So it affects about 180,000 men in 2016. 16,000 of them are in Florida. This is every year.
Wow.
It's responsible for 26,000 deaths. So traditionally, prostate cancer has been treated by a combination of ways. One is to do surgery and one is to do radiation. But these two procedures cause some life-altering side effects, such as sexual dysfunction and incontinence. For the first time, we now have a new treatment called high-intensity focused ultrasound. It's pretty revolutionary in my opinion because it has been present. For a treatment to be acceptable, you have to have a track record of 10 to 15 years, and this has been tested in France and Germany, countries with the most experience, for about 15 years. It has very good results comparable
Really?
to surgery and radiation, yet it has very low side effects. The treatment is pretty much non-invasive because it's a probe in the rectum. You treat the prostate with heat,
Oh,
and that's it. There's no needles, there's no scalpel, there's no radiation.
How much heat?
So when you have a focused ultrasound, it's much like a magnifying glass focused onto a leaf.
Oh my
So you
gosh.
get point heat.
You can aim it, I hope.
Exactly. So it's millimeter precision without any surrounding area damage.
That is amazing, really.
Millimeter size lesions. And you can actually sort of heat the prostate and kill the cancer cells. The temperature rises quickly when it's focused, but it's very controlled.
and is this performed with robotic surgery?
Correct. So there is no robotic surgery as such. You place the probe in the rectum and the patient is under anesthesia because you don't want the patient to move. You have to have millimeter precision. So once you put the probe in the rectum, the patient gets the heat treatment and the robotic movements of the probe treated. So the surgeon or physician sits at a computer console and just makes sure that it's treating the areas that you direct it to. So once you put the probe in, there's really no touching the probe. It just does its job.
Oh, my.
And you're just sitting at the computer looking at the lesions being made.
And you know how many prostate cancer patients do we have? And hopefully, if you are listening, this is really, really very informative. So in
Yeah.
other words, HIFU, H-I-F-U, it's high intensity focused ultrasound.
The good thing about this is that we believe that this will revolutionize prostate cancer treatment as we know it. As of present, there's one drawback, and that is even though it's FDA approved, there's a process of 1 to 2 years before Medicare and all these other insurances start
No,
paying.
it's always that, right? It's always in the way.
that
Yeah.
So it's self-pay at present, but we expect some initial codes to happen this year, and within a year or a year and a half, we expect every insurance to pay for it. So for a long time, this has been a big problem for men. They don't want to get treated, especially older men, if you can imagine, patients who are like 75 and over form a large proportion of the aging male population with prostate cancer, but they don't get treated because they don't want to have surgery and they feel like, well, radiation has some side effects too. It doesn't happen often, but in a few percentage of patients, they're going to get this urinary problems and they get rectal problems. So they don't want to have any treatment. They say, let's go watchful waiting. But cancer doesn't respect age. It can happen that the older person can also have an aggressive cancer, and so it can grow. So this treatment is now very well suited for older men because it really doesn't compromise anything.
Oh, really? So we can still have fun. That's what I'm looking for. All right.
That's the first thing everybody asks me, doctor. How is this going to affect sexual function?
Yeah.
And
it's the only thing we live for.
Continence.
We're like salmon. We go upstream, we die. we have a phone call, and let's take that phone call and say good morning. Thank you for calling in for waiting. You're on the air.
Good morning.
Hey, good morning, everyone. Always fascinating, Bern. Always fascinating.
Thank you.
Just a quick question for the doctor. With the surge in treatment using marijuana cannabinoids, I've read that in Europe, again, where they use procedures that aren't allowed here, that they are injecting a form of THC directly into the tumors and killing the tumors. And I just wondered, I'd rather hear from the doctor instead of stuff I've read on the internet, because, like Abraham Lincoln said, everything on the internet's true. But I'll hang up and get the answer. It's always a good show. Thank you.
Thank you.
Well, I think if you look at cannabis and the products of it injected into tumors, there are some anecdotal studies that say they may help in certain tumors, but we're a long way from that in terms of clinical effectiveness.
We're up against a break, so we'll take a little break, and
Thank you.
we will be right back.
We'll be back.
If you want to call in, you are invited to do that. Bern Paraiso is here from Good for All Marketing, and Bern's special guest is Dr. P. Narayan, and we're talking about urology. He is a urologist, but specifically about prostates and prostate cancer, and we'll be right back.
Thank you.
Weather is brought to you by myfwc.com. Safe boating is no accident. A mix of clouds and sunshine Monday, breezy this afternoon. High Monday 77 to 83 degrees. Monday night, patchy clouds, low 55 to 66. Tuesday, a mix of clouds and sunshine, breezy in the afternoon on Tuesday. High 78 to 83. Wednesday, sunny to partly cloudy and becoming breezy. High 78 to 83 on Wednesday. From the Florida Weather Center, I'm Mike Lucini.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Hi, my name is Erica Olstein. I'm a doctor of acupuncture and oriental medicine. Do you have a gout-ridden toe or bowels that move too slow, creaky knees, or how about an asthmatic wheeze? Then acupuncture is sure to please. Come visit me, your primary care physician, Erica Olstein, at A Better You Healthcare. Call me at 352-615-5566. That's 352-615-5566.
Here's what you may have missed on the John Tesh Radio Show.
66% of couples say watching TV together has strengthened their relationship, and 1 in 3 single millennials say they've chosen not to date somebody because of their TV viewing preferences. When your dog is trying to make himself as small as possible, he's trying to disappear because he's uncomfortable. Talking on the phone hands-free while driving is just as distracting and dangerous as using a handheld phone.
Intelligence for your life on the John Tesh Radio Show. Don't miss this stuff.
Tired of looking at stained carpets, dirty tile, or grout? Call Silverback Restoration, 414-5312. Make your flooring look great again. Stains, pet odors, allergies. Call Silverback Restoration, 414-5312. From serving our country to serving our community. Silverback Restoration, 414-5312. Residential and commercial. Their work is guaranteed along with your satisfaction. Check their website, silverbackrestoration.com.
On May 6th from 6 till 9 p.m., embark on a magical night at the Appleton Museum of Art. Grab a golden tablet for an enchanting adventure with unicorn carriage rides, magic shows, mermaids, artwork that comes to life, and more. Make eye-popping art in the art space and enjoy refreshments. Family ticket package is $30 for members, $45 for non-members. Individual tickets are also available. For details and to purchase tickets, visit appletonmuseum.org. All right, 20 minutes after 9 o'clock, 64 degrees here at the Paddock Mall. Bern Paraiso is here from Good for All Marketing, and Bern's special guest today is Dr. Perry Narayan. He is a urologist, and Bern, do you have a name for Dr. Narayan's office? Is there a...
Well, he is with Urology 1, and the location is 3256 South Pine Avenue. It's in Ocala.
Okay.
And you can call and schedule your appointment at area code 352-338-2089 or 352-219-7137. However, if you want to reach me, I'll be able to help you. It's area code 352-622-6432. So,
you are the go-to lady when we're trying to figure out which doctor to go to.
Yes, sir.
Right? Do you know the one thing that came up during the break, doctor, was that a lot of times you don't think of a man doesn't think of a urologist unless something is wrong. And you mentioned lowering testosterone rates. Maybe a man wouldn't even know he has the lowering testosterone rates. What are the telltale signs?
Correct. So this has become a big problem as a man gets older, because there's supposedly 65,000 men, there's about 10,000 men becoming over 65 every day in this country. That's the demographics. That being said, the testosterone starts getting lower as a man gets older, and the condition is called hypogonadism, and it causes sexual dysfunction. They lose desire, they lose ability to perform, they don't get erectile function. The second thing that happens also is it affects the rest of the body. So people just have fatigue, lack of energy, and sometimes it may even affect heart disease. It may cause heart disease and strokes, because lowering testosterone does all of this. So I would encourage a patient, a man, if he has some symptoms of fatigue, weakness, and lack of energy, to go see his primary care or urologist and get a serum testosterone level checked. And if it is low, we can actually, a variety of ways to raise this. There's gels and creams, there's injections, and there's small little rice-like pellets that we can implant that last 6 months at a time that builds up the testosterone.
Really?
Wow.
Yeah, very interesting.
Is it a bump? Where do you put it?
So basically, we've just put it like a little injection in the back, buttock, or in the arm. The idea is that you want to normalize the testosterone. We're not talking about the steroid type treatment where you want to kind of do abnormal.
So what have you seen in your patients? I would love to hear like an example. Somebody came into you and you gave them this.
Oh, all day long. We have patients every day being referred by primary care doctors because of this problem, and it's paid by insurance because hypogonadism is a recognized
I like that
condition.
name, hypergonadism.
Correct. You have lowered testosterone because of aging. There is less testosterone production in the body, and it's a normal feature of aging, but you can overcome it with the exogenous testosterone, as we call it, in the right amount.
So what is the main there were so many healthy reasons to show up, but I live in a man's body. I know we don't usually worry about those things. The only thing we worry about is,
it comes
having fun.
It comes on so gradually that most men don't realize it, but the usual reason they present is they say, "Doctor, I've not been able to perform over the last several years. My erectile function has gone down. Is this normal?" Now, in the old days, we would say, "Oh, it's normal aging." But we found out in the last 5 to 10 years that it's not necessarily normal, and lowering of testosterone can do this. And in fact, if you have other conditions such as diabetes, it can actually cause it to happen faster at a younger age.
But don't you want to drive at the same speed as your wife? Are you going to... what if you're all of a sudden wanting it and she's saying, that's good for you.
And I am tired.
You got a very good point there, because many of the men will come in and the wife is like, well, I don't know if this new man is what I...
Yeah, really. So what do you do for her?
Well, there's actually new data now that women also need hormonal balancing, and there are a variety of ways of increasing a woman's need for increasing libido and normalization, and that's kind of a little bit behind the men because the men are more aggressive in this manner, but clearly that's also happening at the same time, and there are testosterone and estrogen preparations for women now.
And how do you do that? So it's, again, you go to your primary care and you do all series of blood work. For example, a well check, and usually this is when you get your blood test. So you will get a PSA, and I know that because after communicating with, the medical providers, this is like more of a requirement for your well check. So when it is elevated, so that's when you explore
that's
further.
The red flag. That's the red
exactly,
flag.
and then usually your doctor will refer you to a urologist.
You want to take another phone call?
Yes.
Good morning. Thank you for calling and for waiting. You're on the air.
Yes. Does a vasectomy have any effect on the prostate, especially later in life?
The quick answer is no. They thought that they did, and they've done randomized clinical trials, and they found that vasectomy does not have any long-term side effects on the prostate or any other problem.
Thank you.
Thank you.
Thank you.
And anyway, let's go back to the high intensity focused ultrasound. So this is a high intensity ultrasound, and it is focused. So you can ramble it. It's HIFU. You can Google it.
I like the initials.
If you would like to find out and know more about the HIFU, that Dr.
We have a website called HIFU Solution, without an S, HIFUsolution.com. You can go to it, and it has a full description of what prostate disease is about, what HIFU does, and how it may help a patient with prostate cancer. It is relatively new. It was approved in October 2015 by the FDA, but since approval, over 1,000 patients have been treated. There are about 30 centers in the USA doing it, and there are also major universities that are involved in it, such as University of Miami, the Cleveland Clinic, Duke University, New York University, Indiana, USC, and so on and so forth. We ourselves have a center in Ocala.
The one thing I've often wondered about with prostate cancer is that it's the only cancer that, as a radio host, we talk to a lot of people, so that's my only experience. But it's the only cancer I ever hear of where we've heard, and I think you sort of alluded to it, you can let it go. Just live with it.
Yes. So what happens with prostate cancer is that if you take a 65-year-old, about 40-50% of them will have prostate cancer, and about half of them don't need to be treated because it won't grow during his lifetime. That kind of presence is there in other cancers, but it's more so in prostate cancer. We call it the indolent cancers that don't grow much. The question always comes in, how do we differentiate this? The way we differentiate this is with a PSA. If your PSA is continuing to rise more than 0.5 per year, then you got a problem because it's not a benign condition that's causing this. So enlarged prostate is very common, and a little bit of PSA elevation can be due to the enlarged prostate. If it goes more than 0.5 a year consistently, then it's probably due to prostate cancer that's growing. So we call it the aggressive cancers. Those are the ones we need to treat. And today, there's been paradigm shift in prostate cancer management. We have something called MRI, and we have a test called 4K test. These two tests can actually tell you what is the chance of you having aggressive cancer. Once you do that, those are the cancers that need to be treated.
Oh, wow. That's an important test, then.
Very, yeah.
And we've got 1 minute, so if you can maybe give contact information.
Sure. We will wrap it up. Dr. Perry Narayan, he treats the following condition. It's BPH, or enlarged prostate, infertility in women or men. We also have interstitial cystitis Kidney stones, this is very common. Urinary incontinence or overactive bladder. Prostatitis, sexual dysfunction, and urinary tract infections. So if you would like to know more about Dr. Perry Narayan, MD, at Urology 1, he's located at 3256 South Pine Avenue, and it's right here in Ocala. It's local. And you can reach area code 352-219-7137 or simply call me at 352-622-6432. I want to thank all the callers and all our primary care providers that are listening today. Let me greet Dr. J. Rao and Dr. Sandra Patty, and of course Helen Green, the office manager there. And I want to thank Dr. Perry Narayan for being here with us this morning. And thank you, callers, and hopefully we will be back in the future. We will keep you posted as far as the date. And I'm Bern Paraiso with Robin and Larry, and Dr. Perry Narayan would like to say
Thank you very much.
Thank you very much, and you all have a good week.
Thank you. We will now join the news right in progress.
This morning, when Neil Gorsuch is sworn in, the ninth seat on the court has been vacant since Justice Antonin Scalia died 14 months ago. At the Texas Motor Speedway on Fox,